Small Nova Scotia town, one man is trying to get the word out about what he says are the healing properties of hemp oil, marijuana. But as Ross Lord explains, where he's spreading the word has created a major headache with no cure in sight.
In McCann, Nova Scotia, this oil is gaining a reputation as a miracle drug.
That's the cure right there.
Oil extracted from marijuana plants. Rick Simpson has been making it and giving it to friends and neighbors. He calls it hemp oil. Others know it as weed oil. In small doses, he says, it makes you well without getting you high.
Well, you can't deny your own eyes, can you? Now, here's somebody dying from cancer, they're not dying anymore. Here's somebody that had something else, well, they're cured. And this is what's doing it.
Dozens of major studies have been published in the last few years that indicate that the chemicals in cannabis, in the lab and in animals, have a significant effect on fighting almost all major cancers, including brain, breast, prostate, lung, thyroid, colon, skin, pituitary, melanoma, and leukemia cancers. They do this by promoting the death of cancer cells that have forgotten how to die, as well as a reduction in their crucial blood supply, while leaving healthy cells untouched. But why, you may wonder, would cannabis have any effect on cancer? The answer can be explained in one word: endocannabinoids. Amazing as it sounds, we're all born with a form of cannabis already in our bodies. It's called the endocannabinoid system. The endocannabinoid system, or ECS, influences multiple physiological processes. This intricate system modulates energy intake as well as nutrient transport, metabolism, and storage. A completely natural collection of compounds, endocannabinoids are our body's own form of marijuana and are involved in most of our cells and structures. They control a variety of functions in the nervous system, heart, reproductive, and immune systems. Endocannabinoid messengers help the cells communicate. Typically, they protect our good cells while killing the bad ones, like cancer cells. In all animals, the nervous system is made of the same components, large numbers of nerve cells carrying electrical signals. And wherever the cells meet, these signals are passed to a receptor in the next cell by a chemical messenger called a neurotransmitter. Inside the brain, there are different types of neurotransmitters, including dopamine and serotonin. All animals, from rodents to fish to elephants to humans, have inherited this basic structure. But hundreds of millions of years ago, the sea squirt and other primitive invertebrates evolved an innovation to this system.
There's nothing else that impacts on so many of our illnesses. You see, when I talk about these age-related illnesses, we're all aging, but we don't all come down with cardiovascular disease. We don't all come down with autoimmune disease. We don't all come down with cognitive dysfunction. We don't all come down with cancer. But the chances are we're going to come down with one of them. All right? And here we have this one drug that's able to help us holistically with our biochemistry to restore balance. You know, cannabinoids kill cancer cells in many cases. People are not aware of that. They think cancer, cannabis, anti-nausea. It's way beyond that.
So I'm a cancer doctor, and every day I see patients with cancer who have nausea from their chemotherapy or their cancer, loss of appetite, pain, depression, insomnia. And my experience over the past 30 years of being an oncologist is that there's one medicine that I could recommend to patients that can take care of all of those problems. Instead of writing 5 different prescription drugs, all of which have side effects and addictive potential, I can tell my cancer patients to try marijuana to take care of any combination of those symptoms.
For Dr. Niagara-Cotty, the research has gone far beyond treating inflammatory problems. He's narrowing in on the potential of cannabinoids to kill immune cells that have mutated and become cancerous. Once they become cancerous, they no longer die a normal cell death. Instead, they begin growing and spreading uncontrollably.
We were one of the first labs to demonstrate basically that not only the immune cells, the normal immune cells express these cannabinoid receptors called the CB2 receptors, but also that when these immune cells get transformed and they become cancer, to our surprise, we found that these cancer cells continue to express these CB2 receptors.
This was an exciting discovery because the CB2 receptor can act like a target for the cannabinoids. Once they bind with the receptor, they can tell the cancer cell to die.
So basically telling the cells basically to commit suicide, and that's what they do. And we demonstrated that that would be the mechanism by which the cannabinoids can kill the cancer, and therefore it can be used effectively as an anti-cancer agent.
Dr. Niagara-Cotti and his researchers were able to eradicate almost 100% of the cancer in test tubes. But they were skeptical they would see similar results when they moved on to tumors in mice.
To our surprise, we found that almost 25 to 30% of the mice completely rejected the tumor. They were completely cured. And in addition, we found that the remaining mice also, there was a significant reduction in the volume or the size of the tumors as well.
The lab results have been so promising that Dr. Niagara-Cotti is beginning clinical trials with leukemia patients. There's no doubt in his mind that the cannabinoids, either from the plant or lab created, will play a major role in medicine in the future.
I feel that in the next 5 or 10 years, there is going to be exponential growth in cannabinoid research.
It's an area where both the critics and the advocates agree. Scientists are now well on their way to developing medicines based on the cannabinoids. It begs the question, however, will modern medicine eventually make the marijuana plant obsolete?
No, it will not. In fact, it will only enhance it. Okay, because now it's more proof that the plant really does work. Okay, and instead of spending $600 a month on buying the pharmaceutical drug, I can grow my own plant.
There's a wealth of laboratory evidence that these anti-tumor properties kill cancer cells in a variety of ways. There are multiple mechanisms of action identified by which cannabis kills cancer cells, and they're divided into various categories. And among these are anti-proliferative effects. Normally, that's one of the hallmarks of a cancer cell, is that it just keeps reproducing. So if you stop the reproduction, that's an anti-proliferative effect. There are anti-angiogenesis effects, and this means that the cannabinoids will stop the tumor from being able to elaborate or grow new blood vessels to support the growth of the tumor. There are anti-metastatic effects, and that is simple enough to mean that the cannabinoids block the ability of the cancer cells to spread into other tissues. And there's another effect that has a wild name, apoptotic effect. Apoptosis refers to the ability of cannabinoids to speed the death of the abnormal cells. And that's something that is especially important in cancer, because you're able to hasten the death of the cell without disturbing the normal cells around it.
Seth Research Laboratories in California have recently demonstrated that in some tumors, cancer cells are killed by marijuana, while the other healthy cells are left untouched. Cells that stop moving and become still white dots are dead cancer cells. The ability of cannabinoids to kill bad cells while protecting healthy ones is particularly important when we're talking about brain cancer because of the so-called blood-brain barrier. The brain has to be sheltered from outside influences that might hitch a ride on the bloodstream and cause havoc. What is exciting and unique about cannabinoids is that they can pass through the blood-brain barrier because of their slippery, fat-loving nature. Cannabinoids get right into the brain's cancer cells by moving easily through the cell's membranes, which are also composed of lipids. The evidence is piling up in mice-infested labs that the endocannabinoid system, when stimulated by cannabinoids, has an anti-tumor effect and can instruct cancer cells to commit suicide.
This was done by Manuel Guzman's group within the past less than 10 years, and what they showed there was that originally that THC, when injected into a brain tumor in mice and rats, a significant number of those animals the tumor would regress and disappear, so that you actually had survival of rats that would otherwise die. And they examined all the surrounding nerve tissue, and that was all fine, because remember, once again, cannabinoids protect nerves.
Dr. Manuel Guzman is a professor of biochemistry and molecular biology in Madrid, Spain, and is known for his groundbreaking studies on medical cannabis.
Hemos observado que los cannabinoides tienen un efecto inductor de la muerte de las células tumorales, un efecto inhibidor de lo que es el crecimiento, la multiplicación de las células tumorales. Lo que hacen es disminuir el crecimiento de los tumores.
If cannabis might be the miracle cancer cure that everybody's been searching for, then why don't doctors everywhere know about it?
People have a hard time believing that cannabis can have all of these fantastic effects that are described. But what we're doing is we're just stimulating a natural system that's already there. This has been developing for hundreds of millions of years. The invertebrates, the sea squirts, the hydra, there are primitive endocannabinoid systems in those organisms dating back 600-700 million years ago. The cannabis plant came along maybe 50 or 60 million years ago.
Breast cancer kills more than 41,000 American women every year. Researchers in the San Francisco lab are working to shrink that number, and they're doing it with an unusual weapon, marijuana, or at least a compound from it.
And what we found is that this compound called cannabidiol was particularly effective at inhibiting aggressive breast cancers.
What is the evidence that marijuana smoking, habitual marijuana smoking, can lead to lung cancer? With respect to the development of lung cancer, we found no evidence of any increased risk of lung cancer occurrence in association with marijuana smoking alone. The marijuana smokers, if anything, had a reduced risk for developing lung cancer. Not a significantly reduced risk, but reduced less than one-fold, so that means reduced. Whereas the tobacco smokers had a markedly increased risk. If those who smoked more than 2 packs a day had a 20-fold increase in the risk. That's 2,000%. Those who smoked from 1 to 2 packs a day had an 8-fold risk. It's 800%. So that contrasts with no risk, no increased risk, or a slightly reduced risk with the marijuana smokers. THC actually has an anti-tumoral effect. And these are studies that were done both in experimental animals and in cell culture systems, and for different kinds of cancer. For lung cancer, breast cancer, thyroid cancer, prostate cancer, gliomas, brain cancer, that the development and growth, or the growth actually of the tumor is suppressed by THC, and metastases are also suppressed. So how can that be? Well, THC impairs protein synthesis, and it's what we call anti-mitogenic or anti-proliferative. You need, so tumor cells don't as readily proliferate in the presence of THC. They're also anti-angiogenic, so they interfere with the growth and development of new blood vessels that are necessary for metastatic spread. And they also are pro-apoptotic. What is apoptosis? Apoptosis is programmed cell death. So when cells age, there is a mechanism whereby the cells die. It's a non-necrotic death to die off the old cells, and we get rid of them before they have an opportunity to develop mutations that would lead to cancer. So enhancing apoptosis diminishes the risk of the cells becoming cancerous. So marijuana turns out, THC rather, turns out to be pro-apoptotic. So those appear to be the mechanisms that might account for these anti-tumoral effects of THC.
Dr. Lester Grinspoon, Professor of Psychiatry Emeritus at the Harvard Medical School. I learned that despite my training in medicine and science, I had been brainwashed like just about every other citizen in this country, that marijuana was not only not a dangerous drug, but indeed it was remarkably non-toxic. And I had to revise my view of it. In 1967, my son, Danny, who was then 10 years old, was diagnosed as having acute lymphocytic leukemia. He had terrible nausea and vomiting with each session of cancer chemotherapeutic drugs. My wife and I heard about a young man in Houston, Texas,